you today?
I'm good.
Can I have your name and your birthday?
Christopher Simmons, August 2nd, 1987.
My name is Jessica. I'm going to be your nurse today. It's nice to meet you.
Nice to meet you too.
So we're going to be assessing your abdomen and your blood vessels today. So I'm going to go ahead and start off with your blood vessels. I'm just going to palpate your carotid arteries. Good. Separately, I would say they're a +2 on both sides bilaterally, which is great. I'm going to go ahead and palpate your brachial arteries. Good. Radial pulse. Perfect. Take this side. Good. Radial. And I would say both bilaterally are +2 pulses. I'm going to go ahead and take a listen to your carotid arteries with the bell of my stethoscope. If you could just, thank you. Good. Both are negative for bruits. And the same for the brachial and radial pulses. Okay, so at this point, I'm going to have you lay down. Good. I am going to take a feel of your femoral arteries on both sides. Good. I'm going to take a look at your popliteal artery. Perfect. Post-tibial. Dorsalis pedis. Good. Both present, or all three present. Good. And then pedal. Perfect. I would say bilaterally for all three of them would be a +2 pulse. The skin is soft. Texture is non-textured. Color is within normal limits for ethnicity. Hair is present on the legs all the way down. And there seems to be no evidence of peripheral vascular disease in this patient. So I want you to go ahead and put your arms to the side. So I don't see any aortic pulsations. If you could go ahead and just kind of lift your head up, kind of like you're doing a sit-up. Oh, that's it. Good. There are no bulges, hernias present in the abdomen. So I'm going to go ahead and take a heart rate. So we have a pulse of 86. It is a normal rate and rhythm. I don't see any signs or of any edema. And do you have any pain in any of your extremities?
No.
Good. All right. And then lastly, for our blood vessel assessment, I just want to assess your jugular veins. So if you can put your chin up. Good. I can see the jugular waves, but there is no jugular venous distension. So then we're going to go ahead and move on to our abdominal assessment. So the abdomen, do you mind if I lift your shirt up?
No.
Okay. So the abdomen is symmetrical, is appearing normal. There is hair on the abdomen. There is no different colors or textures in the skin. It is cool to touch, dry, and we already did the hernia assessment where he lifted his head off the bed, and we are negative for any hernias or separation of muscles when asked to raise his head. So I'm going to go ahead and take a listen to your stomach, take a listen to your bowel sounds. So we're going to go ahead and start with the right lower quadrant. Good. We have some very normal active bowel sounds in all 4 quadrants. I'm going to go ahead and auscultate the abdominal aorta. Good. No bruits noted. And then we're going to auscultate both renal arteries. Good. All right. So we're going to go ahead and do some percussion. So I'm just going to do some light tapping on your abdomen.
Okay.
Okay. So we did some light percussion on all 9 quadrants. And there were differences in dullness versus okay. So on percussion, there is dullness over the spleen and dullness over the liver. So at this point, we're going to go ahead and do some light palpation. So let me know if you have any pain or tenderness when I am palpating the abdomen.
No pain.
No? Okay. So we're going to go ahead and assess the border of the liver. So right under the right rib cage, I can feel the liver border. It is not enlarged or edematous. So then we are going to go in for deep palpation and let me know if you feel any tenderness or pain? Any pain or tenderness for you?
No.
Okay. So we're going to go ahead and assess McBurney's point for any appendix pain. So we're going to go on the right side and go up this angle and just kind of press right in this area. Do you have any pain here?
No.
No. Okay. And then we'll go ahead and palpate the gallbladder, which is in this region, and we're going to be assessing for any rebound tenderness. So I want you to take a breath in, and then I'm going to press down, and I want you to tell me if you have any pain right now.
No.
And then once I let go, do you have any pain?
No.
Good. Okay, so that is negative. All right. And like we already said, we do not have any masses or bulges in the abdomen. And then lastly, I'm going to go ahead and assess for kidney tenderness. So I'm just going to put my hand under his side here and press up.
No pain.
No pain or tenderness there. And we're going to go ahead and do the other side bilaterally. Any pain there?
No.
Good. All right. So that concludes our abdominal and blood vessel assessment.
Wonderful.
Thank you, Mr. Simmons.
You're very welcome.
See you next week.